it's also been very interesting because we went from 100% face-to-face to all I'm doing is telephone calls. We have to like ask, we have to ask to do like a Skype type situation. And for this next generation, you know, my 18 and 25-year-olds, to do a hour phone session is tough. Like,
Yeah, a long
so
time.
different. It's so different for this generation. And so we moved from this like connectedness where we can talk like face to face to how do I hold a conversation over the phone? And how are they learning right now that we can talk about big things and you can cry over the phone and we can hold, and how do I work differently for holding pauses? And it's been a very unique and dynamic, if that's the word I want to use, shift of, and really shift a paradigm of how I work with this group of people. And I think that it's been a big learning lesson, not only for myself, but I think for my kiddos too. And I call them kiddos because they're younger than me. And it's been a wonderful experience. It's been hard at times. Our clinic has lost 5 people this year, either due to physical health issues or death by suicide. And it's tough. Like, I think that in the back of your mind, especially going into this field in therapy, like you think about there's a possibility that you'll lose someone, but this is my year, my first ever person. And so this will be a big year for a lot of different reasons. And I think that our clinic has felt the heat, like just like felt the weight of like not just COVID, but making these adjustments and trying to be as compassionate and flexible for our clients and trying to figure out how to feel safe in the office and then kind of do some remote work. And it's a balancing act for sure.
It's Skype. You're doing some audio only counseling.
So I'm doing over the phone only because I'm working remotely. And then if we're not using Skype, we're using a different system, but we can ask our like directors, like, hey, like we think that this person might benefit from face to face, kind of like Zoom type. And so say, for example, someone's like having really acute psychotic symptoms. If I can't visually see them, maybe I won't just know, like,
Step on it.
yeah. And so we can articulate like and advocate like, hey, I think that it'd be better to be able to see them instead of just doing it over the phone. Because if you tell me that you're fine over the phone, it's kind of tough to know. And sometimes, you know, affect doesn't necessarily reflect what people say.
Yeah, Brittany, we have the hospitals doing. Oh.
Go ahead.
Oh yeah, I was gonna say my hospital is doing the same thing, where we have in-person appointments where I look like something out of Outbreak, much like Brent was saying earlier. I've got goggles, I've got a mask, I've got this face shield, and I'm going into this room to do therapy with you. You know, looking like all that's missing is a monkey. You know, and then I have the video appointments, which go much like this, and then I have telephone appointments. And you're absolutely right. Having to be flexible and doing therapy in many different modalities at the same time. And I might have a session in person, go back to my office, do one on video, and then right after that have one on the phone. And having to switch, because it's a very different skill set when you're doing things in person than if you're doing something on the phone. Because if I wait for that, they said something weighty. Let's let that develop for a moment. Let me pause. And then I hear them say, "Are you still there?" "Oh, yes, I'm still here. You just said something really important." And yeah.
Are you muted?
Yeah, no, I can hear you. Exactly. Yeah. And kind of like Brett was saying, I don't know if I could give credit to the work, I would, but I can't remember who wrote it. But there was a little comic panel that I saw that posted around Facebook that I absolutely loved. And in it, there's a chair, an empty chair, and in front of it is the notepad and the pencil. and over to the side is the chaise lounge chair, like the traditional psychotherapy chair,
Mm-hmm.
but in it is two men, you know, the client and the therapist has just got his hands over his chest, and they're both just staring blankly at the ceiling, and beneath it says 2020. And I felt that in my soul, you know.
Brian, one thing that you said that triggered just a remembrance for me really was working in the hospital, and the fact that because we had people from so many different cultures coming into the hospital, that we were constantly having to adapt what we did. There wasn't one script that worked with every family, but you had to listen to what their needs were and appropriately make the changes that were necessary. So, and I think that's a similar thing that's happening now. It sounds like just a different causation.
Right, right. The culture of doing therapy in an audio only format, and then having to sort of change your approach for that, knowing that at the end of this hour, I may have to switch my approach again because I'm going to be face to face with someone.
Sure.
Brittany mentioned the suicides. I've heard that the suicide rate has gone up among people in counseling professions, among people who work on the first line, nurses and counselors, and I assume it's not just sheer volume. I'm guessing, but I'm not there. I'm guessing that also has to do with some changes in the nature of these occupations. What are your experiences, your thoughts?
A lot of it is the volume and the PTSD factor, I think, that the clinicians are dealing with, because they're in it constantly, and it's just one right after the other. And I really think that has its effect. And I remember my own experience, as being the coordinator of bereavement services, and I averaged 1,500 deaths a year. And that volume didn't even touch what's being experienced now, and yet I know how it affected me, being in other people's grief that much all the time. It takes its toll.
I agree, and I've seen. I like the way you brought up the PTSD aspect of it. That that there's even that irritability or very sensitive type of triggers for some of the people in the healthcare profession. They're watching people die every day, and then they pick up their phone and they see, a friend, a family member, a cousin, who's decided that, what, to heck with these precautions, let's go have, a fun night out. And I've seen, who are normally very calm, take off into a rant and just verbally assail their friend, coworker, neighbor, because they've just seen too much of it.
It seems that there is a bit of helplessness of, I'm exhausting myself to do as much as I possibly can, and still there's more. And still there's more work, and still there's more people who are sick, and still, and kind of like what you were saying, Brian, there's people who do and don't, and on the spectrum of if we have this idea of like, how much do you believe or don't believe in COVID, or take precautions or don't take precautions, there is a spectrum of all of it. And I think that there is some bit of fatigue at some point, like it's session after session after loss. And I know, especially with, I would say in the last month, I've had my most acute clients, and it can be exhausting. It's hard to turn off the switch. And I think that's something else that's interesting with working remotely or working from home. It's a lot. I was talking to my husband about this a couple of days ago. It's a lot harder to separate yourself from your work home experience when you're now at home working.
Sure.
And so if I'm having a particular hard day and someone calls and I have to do a Terrasoft or a 50, one of my clients has to go to the hospital for 5150, now I'm just upstairs and then trying to go downstairs in a minute and a half later to grab some food. And I'm the idea of taking it home with you is abstract now because you are here. And so I think that it's difficult in a lot of different ways to adjust for a lot of people who are in the helping profession, for so many reasons, not just for the clients that we work with or the people that we work with, regardless if it's doctors or nurses or therapists, but it's also because our lives are changed too. Like we are adjusting in a unique way too.
You've got a lot of changes in the familiar boundaries, the work-home boundaries, and different kinds of boundaries between you and the clients.
Yeah. Especially if you're thinking, like if you're doing this, like my clients might see my house, like might see this is my kid's name. Like, you know, like it's
Sure.
different.
That's an invasion of privacy.
Yeah, this is up here because my wife did not want her students to see our house.
Ah, okay.
Yeah.
So what do you do? Are you, obviously you're probably still struggling with figuring some of these things out, but what do you do to figure out your new boundaries and to find a mentally safe place for yourself, or even supporting your fellow counselors? Or is everybody so busy that they're and distant that they're failing to support their fellow counselors?
For myself, being a frontline worker and working in treatment centers, it's difficult. Brittany, I'll be on the flip side of that. There's this connect with how these companies are operating, and then here I am, not only as the professional, with my own concern with COVID-19 and needing to take care of myself and my clients, but then I'm putting all these ethical dilemmas that are like, okay, here I am working with a client, he's not being compliant because he's detoxing, and then he's not wearing a mask because he can't breathe. And then next thing you know, like I'm in contact with the individual, and then boom, this person is showing symptomatic stuff. And I'm like, oh great, I just did an intake with this individual and I've been full on exposed. And then you're torn because you're like, okay, do I finish what I'm doing to the best of my ability, cleaning my hands and doing everything? But then now I have to think about, okay, so what can we do for corrective actions? Or now I'm going to have to debate, how am I going to go home, clean off, make sure that I'm disinfectant without exposing my infant, my wife who's asthmatic, and then also my in-laws that are like in their 60s. So like it puts in that torn aspect of the ethics of like, what do I do? One, I need the job to support and pay bills and be there support with clients, but at the same time, two, I'm there and I'm exposing myself. And then it's just like this messiness that I think for a lot of us, where if it's the telehealth platform or frontline workers, we're just learning to adapt in new ways that there's protocols are not in place and they're breaking down, and the compassion fatigue does kick in. It's already tough enough within the field of substance use with losing clients. I've lost over 80 different clients in the past several years of my career. That's where I got into grief and trauma work, because of being a student at one point and then having all this, and I didn't have much resources. So I had to equip myself to learn about grief and loss and how to protect myself as a therapist at the same time. And then also showing up each day, whether for telehealth or, on frontline, it's exhausting because people are at different levels where they're at, not only mentally, emotionally, spiritually, and physically, but just in general. And it just, at least for me, it appears just something comes to my mind. I had a client that just left the other day of treatment and then got hit with 2 groups back to back. One, his nephew had an accident, and then boom, the next day, his daughter committed suicide, young teenager. And it's just like,
Wow.
My heart breaks because I'm like, here we set this person with an aftercare plan back home. He's going to do good in his sobriety. And then on top of that too, it's like, okay, how do you deal with those two on top of everything on what you came to treatment for? And how are you supposed to, go forward to the best of your ability without relapsing or going into like this death spiral? So it does, I think, provide very new challenges for us as counselors and psychologists, as professionals.
Before we started the recording, I'd mentioned that in this past year, I'd had 5 close family members die in the course of 9 months. Yeah. And losses of other people that I'd known, friends, very close friends of friends, some friends who were like relatives in different forms and different kinds of deaths. And none of these were related to COVID. But one of them had been someone who committed suicide. And you can't help but wonder, would that suicide have happened if the world situation were different? Even though it wasn't directly about the disease, even though it doesn't seem like it was directly about isolation because this individual had some family there. However, she was feeling cut off from those who were right there. And so the isolation, the separateness she felt from others at that particular moment, would she have felt that at other times? And we can never know. We do know there are going to be people who are going to be much more at risk for suicide. It's
Sure.
How has this changed how you might deal with anyone with suicidal potential or the fear of it?
The hospital that I work for is both a medical hospital and has a psychiatric hospital as part of it. And so it's interesting that we had a psychiatric unit that was only for COVID positive patients. We had to create that kind of a system. We had to have a way to help people, because again, there was a time when there was an isolating moment, but they didn't understand COVID. You've got this disease, and you didn't want to tell your friends. So you might have people that were on the COVID units, the medical units, that start developing suicidal thoughts, and working in that kind of a system, or having people who were then afraid to reach out. They were having these problems. They were having suicidal thoughts. They were having a lot of pressures, family pressures, situational pressures, but they didn't want to call and be hospitalized for fear that it's incredibly hard to be socially distant on an inpatient psychiatric unit. They're not designed for that. And so then there's the fear of, do I risk getting sick in trying to get my mental health? Do I risk getting physically ill in an attempt to get my mental health treated? And so it became very complex, and a world I don't think we've ever been anything like that before, where somebody was afraid to go to the hospital for psychiatric reasons for fear that they would get a physical illness.
And Brian, I think it goes beyond just psychiatric stuff, but fear of going to the hospital, period.
Oh, yes.
Nobody will let you in to visit, and it's that fear of what's going to happen if I go there.
Yeah, I mentioned a family member with stage 4 pancreatic cancer, and cancer has so many complicating factors, and so she would become very, very sick. For things that we didn't know what they were. We knew they weren't COVID. They didn't have anything like that, but she was very sick. And now you have to take her to the hospital. Here's a vulnerable person with a compromised immune system, and you're having to figure out, how do we get this person medical treatment in a situation where getting the medical treatment might present its own level of dangerousness that we can't anticipate for. Yeah,
sure.
Because it's physical health too. And then I was thinking, so I'm originally from Indiana, and when all of this started in Indianapolis, it was, if you went to the hospital for a broken foot, for stomach issues, for anything, you were mandated to stay for 2 weeks. And so could you imagine if something happens, you get into like a car accident, and then like you're not there for all the reasons, but now you have no income for 2 weeks. You're mandated to stay in a place that may or may not like raise your likelihood of exposure. Like everything was moving so quick at the beginning of COVID. Like I just couldn't imagine like the pressure of saying, I'll be fine. I'm fine, because I don't want it to be nothing and then have to spend 2 weeks at the hospital. Like
so the stressor of that alone.
Yeah. It's just going to compound like everything else. And so then you're making decisions based on, how serious do I think that this is in comparison to something else. I'm thinking, Brett, like if that were the situation, like did your water breaker not, like, so now would your wife have to be in the hospital? Like that would be a tough call.
Mhm.
And we've got isolation during these moments that are normally times of celebration, such as the birth of your child, and not having the same baby showers or just people showing up and swinging by the hospital. We've got this isolation during the worst of times, when people are terminally ill and or hospitalized for other reasons. Yeah, one of my oldest friends, the oldest in terms of I've known him the longest, not just he's a really old guy. No, he's my age. He has stage 4 cancer, and the prognosis has gone from 3 to 5 years to 1 to 2 to shorter depending on what they just saw in his liver, and they're using the word terminal now. And he's having to do these things in isolation. He's a minister of a church. He's got all kinds of support in many different ways, but it's definitely not the same. People aren't stopping by to give the hugs that Dan was talking about. And I would imagine it's harder in a lot of ways. On the suicide issue, it's like with these particular individuals, maybe not, but there have to be those who are thinking about it harder than they would have if they'd had the social support there at hand. There have to be those who are committing suicide who would not have otherwise. And what do you even see that they might do differently or anybody in their lives might do differently to try to help change that path?
I think it's a really, really difficult time for that because, a lot of those factors, being able to sit down with someone and talk with them personally, one-on-one, touch them, whatever. I just think it's really difficult. And can you Skype with them or talk with them on the phone? Sure. Is that the same? I don't think so. And so I think it's a really not, I don't want to say scary time. It is that too, but I think it's really about how do we as people connect with each other.
It would also be helpful finding other creative things you can do that make it where it's not just talking to people. Okay, we're talking. Find a way to actually be doing something together. I know a lot of individuals are finding ways to play games with their friends online. Certain games have even made the news because of individuals playing their sessions of these online games. AOC playing, whatever that game was about, you find the fake and there we go, Among Us. My kids introduced me to the game. I was typing the name, and they've got a regular game night with their friends. My terminally ill friend. We're playing Dungeons and Dragons every once in a while through
That's
Zoom.
what I'm doing.
It
Through
is an
Zoom,
active
yes.
thing. You're doing something lively, not just talking to each other.
Yes. Every week, some friends that we really haven't been that close and communicated that often since college, and ever since lockdown, every Tuesday night we take to playing Dungeons and Dragons through Zoom in order to, and again, for several years before that, we hadn't been communicating that often, but that sense of, like you said, doing something together has been very meaningful, I think, for all of us.
We're spending a lot of time on the problems. It can be real hard to figure out answers.
Yes, good luck with that.
What do you see being lasting changes to how counseling is working now? People look forward to the day when we can get back to normal, but people also recognize normal is not going to be normal. I know just even some of the states where it was difficult for legal reasons or payment reasons to get paid for telehealth for counseling, or whether it's AV or just audio. Once those changes have been made, they're in there, and I imagine that would be one of the lasting changes. is that now telehealth is going to be more common than it was before. And in the counseling area, for some individuals, they may stick with that. Or maybe not. It's like you've also mentioned a lot of short. Although you're nodding, you mentioned some of the shortcomings with that yourself, but you are nodding.
That's a perfect example of saying, like, there are probably going to be some people who say, I mean, I've been working from home, I've been working remotely. Can we do 60, 50, 30% telehealth as opposed to seeing in person? And I know that I'm not going to be working remotely forever. At some point, I have to return to work. At some point, I have to go back to the office. And at our office, they literally carved out a hole in the wall so that they're going to put a glass screen in so that you're in one room and then the client's in the other room, and then they pick up a phone and like you guys are talking through a glass.
Like you're in prison. Like you're in prison.
Yes. And I'm just
A
thinking,
meaningful
like,
relationship, right?
Is it worth the drive to the office to come and do that? And even thinking about in our office that you have to articulate and really say, this client needs to come in. What's the necessity to come in face to face, as opposed to we can just do everything over the phone? And I'm thinking, over a long period of time, are we going to ever get back to the normal where everybody comes to the clinic? Or is it going to be a case-by-case situation in which, oh, you're not like a scale of 1 to 10, you're not at a 5 or higher, so then you don't need to come in the office. We can just do this over the phone. I don't know what it'll look like. I think it's going to continue to morph. I think some clients will be relieved to return to, face-to-face sessions, whatever they are, because I think that some structure outside of their home is enough to want to come to therapy, whatever it looks like. But I do think that telehealth looks really exciting to a lot of people, and I don't know where we're going.
I think it's going to be a new normal, Tiffany or Brittany.
Yeah.
Yeah.
So I don't know if Dan or Travis, either one of you are familiar with SIPAC, but SIPAC has been its big year. So it was the sort of interstate practice legislation kinds of things for several states. I think it's up to 15 now. So that if you apply and pass you meet their standards, to join SIPAC, you are able to practice telehealth psychology in those 15 different states. So I could be in Texas seeing somebody in Pennsylvania or someone in Virginia or something like that, because of this legislation. And I think because of this, we will see more of that juggling happen, where I might have my 9 o'clock might be in person and my 10 might be online. That might be just the new normal, as they've been saying.
Yeah.
There might be different laws. I think there's going to be a little bit of flexibility too regarding like distance, like actual distance. So for example, one of the places that I work with, the individuals got displaced because of quarantine. And so now I'm on an instead of it being like you are licensed or you're almost licensed in this state, you could only see people in this state. It's, well, Bob is now in Ohio because he got displaced from he got displaced from no fault of his own. And so we're going to do this short term because they're going to return at some point. So I think that there's going to be a little bit more flexibility of, can you see clients in a different state? Can you see clients if they're traveling? Like, if what happens, especially in San Diego, I live in a border city, like if they're in Mexico for a little bit, like I think there's going to be a shift that way.
Mm-hmm.
I saw it too in Florida, since I'm the registered intern, Florida boards actually were like, hey, listen, we're getting completely slammed. So if you're a registered intern, you can full on do telehealth, as long as you have contact with your supervisor. And from that, I believe from the last time I've read, it's actually staying, it's not going away, which is, I think, beneficial for, those that are coming out of postgraduate programs which is a struggle enough to find jobs and whatnot. This is kind of adding another avenue, definitely a needed area that I see, especially if you think of people with disabilities or different people with medical conditions. I can see definitely improvement with them gaining access to mental health care for the first time, where that might have not been available. And also too, depending on the states and stuff, we might see some of the state boards start alliancing themselves with different states due to demographic areas. There might not have counselors available, but then you go down to Florida, there's more province, and then boom, I can do counseling in Georgia. So it's very exciting to see where the technology is going. I think, COVID-19 just threw us into this like unknown spiral of like kind of like do or die situation of evolving and not evolving. And I do think there's the benefits. Dr. Travis brought up a good point with the gaming stuff and doing geek therapy and stuff. I do workshops on geek therapy because of him and different individuals that have inspired me to pursue that type of path of expertise in. And it amazes me to give those little nuances to therapists or psychologists, and they're like, oh, I never thought of that before. I'm like, yeah, that's another way to connect, and seeing success from it too. My wife is in private practice, and then seeing how she can work with teenagers and being play Fortnite or playing different types of games online with these kids, while it's normalizing and then replacing the lack of human contact, but at least it's there where they can feel kind of safe and kind of almost kind of present themselves some sense of normalcy to be able to open into my life in a different way, possible than doing like, oh, hey, we're going to do Zoom and I want to have you stay focused for an hour on top of what you've been doing for the past 20 hours with school. So, what's one more hour on technology? So there's different, I think, avenues and pathways, and it's very exciting to see where technology or what type of companies will actually rise up to actually go, hey, we need to start reinventing a new type of Zoom or a new type of Skype or a gaming platform, or even Dungeons and Dragons that would be an online component that will bring counselors or professionals in.
Brent, just as I listened to you talk, I was sitting here thinking, whenever a new technology is introduced, it takes a good while for the ethics to catch up with it.
Indeed, it does.
And I think the same thing is going to happen with this. That there are going to be ethical dilemmas that arise that nobody's ever even considered. And I think, Brittany, I think you maybe said it, or Brian, I can't remember which one, but one of you was talking about how fast it's all changing. And, and it really is. I mean, it's throwing a whole new avenue into a lot of different arenas, not just grief, but ethics and, and technology and all of it. So I think there's a lot of change to come.
I have a good friend too, Dan, and who does BetterHealth, and she said that platform has actually spiked and increased with clientele to the point where she has to turn off notification because there's just so much need for that platform, which then gives and tells me kind of statistically for a little bit that everyone's jumping onto this platform very quickly, and there's a need for it, And, Dr. Daniel made your point and stuff with the ethics and trying to play catch up. I think it's kind of forcing the boards maybe a little bit to adjust to not old ways, but then new ways.
What's the rewarding side of being a grief counselor? What does somebody get out of it personally or spiritually? It's like, why do you do it?
Burdens are lighter when carried together. And so I think being there to help someone carry a tremendous load has its own, like, there's a feeling to it that like you said, it's a spiritually, psychologically, it's very rewarding in the sense of I was there when another human being needed another human being.
A little bit of the motivation for me to get into this field is when I was 10, my brother died, and then I was 15 when my dad died. I was 21 when my mom died, and then my other sister just died last year. and along with grandparents and families and other friends. But these, like, grief work is really precious to me. Like I remember my first counselor just like kind of, it was really unfortunate because here I am, a new orphan person in college, and someone who didn't really take the time to take it seriously. Like, we looked at tires for her car, like, in my first session. And and I know that there's a continuum of types of therapists and everything else, and experiencing it, but it's so precious and it's so important, I think, for this field, for people to love what they're doing and to be passionate about it and to want to help and to want to learn and grow. And I think that that's this this thing, if we say like grief and loss, like it's the one true universal to me. And I think that that's so profound that everyone does it, but no one's the same. Like, we are all these like beautiful snowflakes and all of these experiences, and that how I grieved my mom is different than my sister, that is different than my brother, that is different than my aunt and cousin and everything else. It's so big. It's so big and so important to me, and I think that that's the connection, that I see you. I see you, I hear you, I feel you, I understand. And I think that that's kind of this overwhelming feeling of like when I'm sitting with the client and they're sharing their story and it's this testimonial of what they've gone through, and to be able to not say, I don't have to be your cheerleader, I don't have to say like you have to be resilient, you have to be okay, and that I will sit in the darkness with you until we find the light. Like, we'll be here, I'll meet you, I'll walk with you, I will not lead you, I will not push you. I think that that's what like motivates me to continue to be in this field and to work in this specialty, because I think it's important. Like,
And I like your imagery of being the light in the darkness. And I think that's a very profound understanding and statement of it. And I think, and I'm not doing practice or therapy right now in the same way, but I think that idea is one that really resonates in all of the work that all of you are doing.
So with myself, with being, a trauma therapist, I just see everything and how grief is just one component of trauma. And, the reason why I do it is, Brittany painted a beautiful picture for us, for her personal experience as a counselor, just holding space and kind of just being there with people, and that they are seen, heard, and understood. And sometimes not even saying anything, just holding presence with them, to know that what they're going through is a human experience and there's nothing wrong about it. You're going to have the good moments, the bad moments, and the messy moments. There was a TED talk and there's a podcast by a woman called Nora McInerney, and she sits there and says that moving forward instead of moving on. And that has always stuck with me when I saw a TED talk by her years ago, through my own grief and loss and different traumatic experiences that I've gone through as a survivor. And that's what it's about. It's knowing that there's a path of healing, but there's goodness and there's badness and there's messiness of it. And that's okay. As long as we're connecting as human beings to each other, that's all that matters, because we're social beings, and that's what we do. And I think, where we're spiritual or not spiritual, that allows us to connect, I think, on a spiritual component with each other.
Those things are rewarding. I think one of the things that just means the most to me was this message this woman sent to me when she was dealing with her dying father, and she was reading Star Wars psychology, Dark Side of the Mind. It was going to be Jedi mind tricks, but that word Jedi is a big trademark thing. So, and it was in my afterword to the book, I made this comment that the great lesson of Star Wars may be this, that there's never only one hope. And she said that right there was exactly what she needed to hear at that particular point in her life. and that's one of those things, like, yeah, it's like we get to reach people in different ways with this. So that's part of what I want to do with these kind of videos. And I thank you all for joining us.
Yeah.
Mhm.
All right,
Yes.
and here we
Thank
go.
you.
Peace.
And I thank you all for doing this with me.